Hello again everyone, Dr. Dan Bockmann here. Today we have another viewer question we're going to answer, and this viewer is Mike31, and he asks in a comment, as a comment in one of the videos, he says, I often have to wear a knee brace on one or the other knee, and at times both knees, due to old military injuries. He says he's been diagnosed with plantar fasciitis, which for most of you it's heel pain. And it's typically, you notice it when you're getting out of bed first thing in the morning and it feels like you got a terrible bruise or a knife sticking in the bottom of your heel. That's plantar fasciitis. He's been diagnosed with plantar fasciitis in both feet. He's asking, is the plantar fasciitis likely caused by compensating for the knee pain, because we know he has that and he wears braces, or the braces themselves, like are they causing something to go wrong that is giving him the heel pain? Or do you think it's a separate issue altogether? Now, this is a great complex question here, Mike, and the short answer is it could be any one of those things. Without actually looking at you and examining you myself, I can't tell for sure. However, what I will say is that if your knees don't move freely and normally through their full range, you've got limited range or limited ability to use them, then that can absolutely affect feet and ankle. In fact, when it comes to plantar fasciitis, basically if you think of, if this is your leg and this is your foot, your calf is the muscle that points your foot, right? So your calf tapers down, becomes the Achilles tendon, and then along with connective tissue basically spreads out and becomes the plantar fascia, or joins with or is part of the plantar fascia, which is basically a thin leather strip stretched across the bottom of your foot, and it helps maintain your arch and it attaches at the base of your toes. So if that gets inflamed, that drum head stretched across the arch of your foot gets inflamed, it becomes painful to walk on. And of course at nighttime you're not using it all, so it kind of stiffens up, which is why morning times are often the worst time, because it's been shrinking up all night, and then when you step on it, it's like stretched super taut and inflamed. But then you'll find often as you get up, move around a bit, it starts hurting less, and then if you sit for a long time, for example, it'll shrink up again. So same rules with muscles and other soft tissues. They will shrink shorter, get tauter and less elastic unless you're regularly taking them to their full length. Now, going back to your question about what the original cause is, it's kind of hard, it's impossible for me to tell you, but there are things you can do. Calf stretches are the top, tight calves are the top risk factor for this. In your case, I would say. So if your calves are too tight, it can stretch that plantar fascia too tautly or prevent normal motion in the foot, which then allows that shrinkage to happen and it becomes painful to walk on. So loosening up tight calf muscles, top thing I would tell you, also stay hydrated. So in general, for most men, I recommend 3 liters of water a day. It's about 100 ounces, and of course your body size matters and your metabolism matters too, how active you are, how much you perspire, etc. Who knows, maybe meds you're on. But in general, I'll say around 100 ounces a day for men. If you're dehydrated, remember, all your soft tissues, including fascia, as well as muscles and tendons, ligaments, nerves, they're all mostly water. So if you don't consume enough, those things tend to dry up and get stiff and less elastic, which can make this thing more likely to happen. So staying hydrated gives you the ability to have more elastic soft tissues to begin with and less likely to have this thing. There are 2 calf stretches. There's the upper part of the calf, which is the apple-shaped part, and then there's the tapered part toward the bottom, which is the soleus, which then everything kind of melds together, becomes the Achilles tendon, which is the rope that attaches kind of underneath your heel there, near where your pain is. I can't in this video show you the 2 ways to stretch those 2 muscles. The top part, the big apple-shaped part at the top of your calf, is the easiest one to explain, but it's basically if you put your forefoot on a step and let one heel drop down and support yourself with a railing or against a wall, just so you don't lose your balance. You may have to spot yourself with the other foot because it may be too painful to do a full body weight hang in that stretch. You're letting your heel drop toward the floor. You're not standing up into the stretch. So letting your heel drop as much as you can. Do a 2-minute stretch twice a day that is as aggressive as you can handle. And look for, as days go by, you can tolerate that weight more and more, and you have to spot yourself less and less with the other leg. The reason I only do one at a time is because that lets you apply more stretching force. If you stretched both heels off the edge at the same time, that means each side is only getting half your body weight, which may not be enough to give you a big stretch. Whereas if you just do one leg, you've got 100% of your body weight on it. So it doubles the stretching force. So I like to stretch one at a time. You can offload a little weight onto the other foot, and of course check them both and see if improving your flexibility in your calf and ankle helps diminish the severity, frequency, duration of your heel pain. I know this is a complex question. I hope that answer helped a bit. Stay tuned for more videos about this stuff. I'm going to do some talks and some demos about plantar fasciitis in particular. And obviously, if we can get your knees functioning better, then it means your gait improves, and then plantar fasciitis is much less likely to happen as well. If there are braces that feel more comfortable or natural to you, that you tolerate better, wear those. The more naturally you can move, the better, assuming your knee is protected when it needs to be. So I know there's a lot in this that we tried to unpackage here, but hope it's been helpful. If so, subscribe below. And as always, leave any questions you might have in a comment section below. I'd love to answer those in future videos. Until then, see you guys next time.